Blood pressure is equal to the cardiac output, the volume of blood pumped out of the heart per minute, multiplied by the arteriolar resistance. Blood flow depends on the rate of heartbeats and the volume of blood pumped out with each beat. If rate or volume increases, blood pressure goes up. Likewise, increased resistance raises blood pressure, as when arteries downstream from the heart constrict. Over time, high blood pressure or hypertension damages many organs. First, the heart works harder to pump out more blood or against higher resistance. The heart then requires more oxygen and is more susceptible to angina or a heart attack. Second, arteries and arterioles can be damaged. Arterial sclerosis results when blood moves through the vessels at high pressure, damaging the protective cells lining the vessel. White blood cells are drawn to the damaged area and form plaque. Third, kidneys can be damaged. The capillaries of the kidney are delicate. Continually subjected to high blood pressure, they break down, becoming permeable to proteins and other molecules. The kidney's tubules can become clogged, decreasing the kidney's ability to make urine. Also, the proteins injure the capillaries' membranes, causing more damage and worsening the situation. Fourth, the retina of the eye can be injured if its delicate capillaries are damaged. Localized hemorrhages can occur, causing scarring and formation of new, more fragile capillaries to replace the old ones. Finally, the blood vessels of the brain can be injured. High blood pressure can cause clots to break off from atherosclerotic plaques, blocking blood flow to the rest of the brain. This is called a thrombotic stroke. Continual exposure to high blood pressure may also cause a blood vessel to burst, leading to a hemorrhagic stroke.
The heart is a pump which must circulate blood through two different but interconnected vascular systems. The smaller of these systems is the pulmonary system. Blood returning from the upper part of the body is delivered to the right atrium of the heart by the superior vena cava, one of the body's two largest veins, while blood returning from the lower part of the body is delivered to the right atrium by the other major vein, the inferior vena cava. Contraction of the right atrium in each cardiac cycle forces blood into the right ventricle. This is followed by contraction of the right ventricle, which pumps blood into the pulmonary artery, sending it on through the blood vessels of the lungs. As the right ventricle contracts and pressure within the right ventricle rises, the tricuspid valve situated at the opening between the right atrium and right ventricle shuts, preventing any backflow. The pressure generated by contraction of the right ventricle soon opens the pulmonary valve and blood enters the circulation of the lungs. After passing through the circulation of the lungs, the blood, having been recharged with oxygen and having rid itself of carbon dioxide, is returned through the pulmonary veins to the left atrium. The left atrium, too, contracts, forwarding blood into the left ventricle in order to fill it before it contracts. As the powerful left ventricle contracts, the mitral valve shuts, preventing backflow into the left atrium. The aortic valve opens, and blood is forced into the aorta, which distributes it to the rest of the body apart from the lungs. As the contraction comes to an end and pressure in the aorta falls, the aortic valve snaps shut to prevent backflow into the left ventricle. In order for the heart to pump blood through the body, it first has to provide blood to itself so that it can obtain oxygen and nutrients. The myocardium is supplied with blood by two main coronary arteries that arise at the root of the aorta. The left main coronary, which then divides into the left descending and the circumflex, and the right main coronary artery. The main coronary arteries run along the surface of the heart as large epicardial arteries. They also send smaller branch arteries into the myocardium, the intramyocardial arteries. These further divide into a dense network of arterioles and capillaries. This system of vessels provides blood to the myocardium, a process known as perfusion. Myocardial blood flow can be affected by several factors. In a healthy heart, the most important include changes in aortic pressure and compression of myocardial vessels during systole, and changes in oxygen demand. During diastole, the heart muscle relaxes and blood flows into the heart chambers. During the cardiac cycle, the contracting and relaxing heart muscle influences its own blood supply by changing the pressure in the aorta, which affects the flow of blood into coronary arteries, and alternately compressing and releasing the blood vessels in the myocardium. During the systolic phase, the pressure of the contracting cardiac muscle compresses the intramyocardial vessels. In addition, the increased pressure in the ventricles causes further compression of the coronary vessels, thus reducing myocardial blood flow. The heart myocardium needs a significant amount of oxygen to do its work. The cardiac muscle extracts and uses 60 to 80% of the oxygen in the blood flowing through the coronary arteries. By contrast, skeletal muscle extracts only 25 to 30%. Hence, blood flow to the heart myocardium is tightly connected to the cardiac muscle's need for oxygen. The heart myocardium has autoregulatory mechanisms that affect blood flow based on the amount of oxygen that is needed. During periods of increased activity or stress, the cardiac arteries dilate and increase their flow of blood. Ischemia occurs when arteries are unable to dilate to meet myocardial oxygen needs.